prevention. Treatment has something else.
Symptoms.
Symptoms, okay. Sign and symptoms, so diagnosis. Diagnosis, sign and symptoms, and tests, huh? Paraclinic.
Yes.
Test graphics. So, check-up is prevention. You said something about the check-up or screening related to prevention. We will speak about the types of prevention. We have 4 types of prevention. About the
Health and disease.
blah 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 blah, and I put all of them here as determinants. Determinants. Of health-related events. So, what should I put here?
Disease.
What?
Disease.
This is here. Such as disease, illness, disability,
Maybe health.
economy, here. Economy. With the cost of disease or cost of treatment, yeah? All of them related to determinants of the disease. What else? Oh, excuse me. Determinants, we have it here. Excuse me.
Distribution.
So it means we should know, for example, COVID affect which people? Males or female or equal? Young or old or equal? A specific area or affect all of the area of the country. And we found some risk factors, for example, obesity, background diseases, for example, heart diseases, respiratory
Diabetes.
what?
Diabetes.
Yeah, of course. And something to all of these should have a product
Prevention.
to prevent or control of the diseases. Okay? Should perform some studies, and we are together with the specialties prepare for through scientific research proposal and perform the study, and the study have some products such as lectures, some articles, and the final results should be tangible for the people or patients to control and prevent the disease. Okay, and how many levels of the prevention we have? And we have 4 levels of prevention. Primary.
Secondary.
Good. Secondary.
Tertiary, then contrary.
Secondary. Tertiary.
quaternary.
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 Quaternary, huh? Maybe. And, and something here, primordial.
Primordial.
So, say some strategies for prevention of the diseases or
Primordial, what it means primordial? Primordial, before primary. Before primary. Yes.
so
Feel symptoms.
when we feel some
Symptoms, I mean, feel
symptoms,
weak.
some symptoms, if you feel something
It's primary.
abnormal, you will seek a doctor and perform some tests to find the disease, the
Yes.
cause of abnormality. So it's not checkup. Vaccine is other, yeah. So vaccine and checkup. So who perform checkup? In your family, for example, or maybe yourself, or you have a regular checkup?
No.
No. So who have some regular checkups? Who? Maybe old people, yeah? So what's the name of checkups for diseases for checking up?
Blood pressure,
Blood pressure,
diabetes, sugar test,
sugar for diabetes mellitus,
heart disease,
heart disease,
yes,
heart disease, heart cardiography for heart disease maybe. But actually, we perform cardiography for people with symptoms, for example, chest pain or discomfort on arm or neck, with effort, maybe. For example, when they go upstairs and they have some difficulty in breathing or pressure on the chest, we perform echocardiography. But maybe we perform exercise tests on the the echocardiography during running. Okay, all of your examples, are they performed on abnormal condition?
No, sometimes we do like a regular checkup.
So all of them perform on healthy people.
Yes.
Or they think that they are healthy. Okay, so if we draw a natural history of a disease, it will start from healthy conditions. Change to the disease, and the final of the disease is outcome. So here is healthy condition, here is disease, and here is the outcome. What's the outcome? Resolve of the disease, or cure, death, or disability. For the disease, there are a period of asymptomatic. That's a period or phase. And here is a symptomatic one. So the people at the risk of a disease, for example, diabetes, that they don't feel any abnormality, so they are here. They perform checkup, and if the disease started with no symptoms, it's the role of the screening or checkup. So the disease happened, but if we prevent severe disease by finding in early stage,
Yes.
okay, so maybe the treatment is more easily can perform with low cost and more effectiveness, okay? So we put a screening for secondary prevention. For secondary prevention, the disease happened but is asymptomatic. For early diagnosis, to perform treatment or any medical intervention or dental intervention to prevent severe conditions. So, what about the vaccine?
Which may
We
be
perform
healthy.
vaccination in which phase?
Healthy. Healthy base.
In
Healthy.
healthy phase, yeah. So, so the vaccine prevents the disease to be happen. So in this stage, we use vaccine to prevent the disease. Put it here in front of primary. So let's say something in dental science to prevent the disease, for example. Oral hygiene. Good. Other? OPG is an example for screening. You seek about the decay, but
Checking.
without any discoloration, maybe, or
Checking.
without any
Checking all 6 months.
Yes.
6 months. You should go to doctor for checking.
stigma.
For checking.
Or,
Checking your teeth.
oh, okay, checkup.
Checkup.
Dental checkup. So again, dental checkup and OPGs, the examples of screening. You want to find something in the oral cavity. You think about the abnormalities. So the abnormality should be happened.
And sometimes you don't have any normality.
Oh, okay. So the checkup result is negative.
Go in primary part, no?
Good news. So go and come back again 6 months or 1 year later. Okay. So for screening, OPG, dental, we said dental visit. Dental visits, okay? So this is examples of screening. Examples of primary prevention for dental decay. Just say something about the hygiene. Can you explain how the hygiene can be raised in a people? Brushing, brushing. So if we think that the plaque is the cause of the dental decay, by removing the plaque, so you prevent the dental decay. So the examples are here. Brushing, flossing,
Mouthwash.
mouthwash, maybe varnish, maybe fissure sealant. tablet. قرص کلسیم. چرا تابلت میگن. If it is work, we should put it here. The example for primordial. So, what's the difference of the primary and primordial? As I put it before primary, so it should be work
Before
here
we
in
have it.
healthy conditions. So, what's the difference of the primordial and primary prevention? Primary directly related to the cause of the disease, but the primordial related to the risk factors of the disease. So lifestyle, complementary nutrients, for example, calcium, minerals, vitamins, okay? Eating fruits and vegetables, reducing the snacks and carbohydrates, okay? All of them good for health, especially for oral and dental health. So, lifestyle, eating,
And
physical activity, and so on. Physical activity.
fluoride. Fluoride, giving fluoride to the tools.
Yes.
Activity and so on. So, what about the tertiary?
Tertiary. Screen.
Between the complete health, maybe the patient is in a recovery phase, and we should intervene here to ability for coming back earlier to the work, or reducing the absenteeism from the work or the class, something else. Then is rehabilitation. For example, with dentures, with denture, you get back the quality of life to the people. And what about the quaternary prevention, which is new?
Filling.
It's about 3 to 4 years introduced.
Oh. Maybe extraction.
Maybe cancer.
Cancer.
Before that is the last stage. And that is the last stage.
Something related to after death?
before the death.
Before death. Yeah.
Before the death.
Before the death. So what's the quaternary prevention level?
Maybe cancer.
Treatment. Tooth extraction is treatment.
Maybe cancer.
Maybe for cancer, for all the diseases. So to prevent what? To prevent death. It's the work of the treatment and rehabilitation.
Oh, I don't know.
Quaternary is to prevent the death not due to the disease, death due to. And you can prevent side effects. Okay, so quaternary is to prevent the side effects. Side effects related to over treatment or also under treatment, vice versa.
Right.
Today and next week we should I speak about the environmental, family health, and breastfeeding? Good.